Prescription medications for weight gain. 1. Megestrol acetate, Megace. Use: appetite stimulant for cancer patients and AIDS-related cachexia. How it works: increases appetite and food intake. Note: primarily used in medical conditions causing severe weight loss. 2. Dronabinol, Marinol. Synthetic cannabinoid for appetite stimulation. It stimulates appetite centers in the brain. Note: used for AIDS-related anorexia and chemotherapy-induced nausea. 3. Oxandrolone, Anavar. Anabolic steroid for mass muscle gain. It promotes protein synthesis and muscle growth. Note: used for severe weight loss from surgery, infection, or trauma. 4. Cyproheptadine, Periactin. Antihistamine with appetite-stimulating effects. It blocks serotonin and histamine, increasing hunger. Note: often used in children with poor appetite or failure to thrive. 5. Mirtazapine, Marinol. Antidepressant with weight gain as a side effect. It increases appetite and slows metabolism. Note: primary use is for depression, weight gain is a secondary effect. 6. Insulin. Hormone therapy for diabetes promotes weight gain. It helps cells absorb glucose and store fat. Note: used in diabetes management, weight gain can be a side effect. 7. Corticosteroids, Prednisone, Prednisolone. Anti-inflammatory medication that increases appetite. It increases appetite, fluid retention, and fat storage. Note: used for inflammatory conditions, weight gain is a common side effect. 8. Olanzapine, Zyprexa. Antipsychotic medication. It affects neurotransmitters that regulate appetite and metabolism. Note: primary use is for mental health conditions, significant weight gain is common. Supplements and nutritional support. 9. Protein supplements, whey, casein, mass gainers. Use: nutritional supplement to increase calorie and protein intake. How it works: provides concentrated calories and protein for muscle building. Note: over-the-counter, safe when used properly with exercise. 10. Creatine Monohydrate. Use: supplement for muscle mass and strength gain. It increases water retention in muscles and improves workout performance. Note: well-researched, safe for most people, increases muscle volume. Warnings. Before considering any weight gain medication, 1. Medical evaluation essential. Determine the underlying cause of low weight first. 2. Not for cosmetic use. Most prescription medications are for serious medical conditions only. 3. Serious side effects, especially with steroids, antipsychotics, and hormones. 4. Proper diagnosis needed. Unexplained weight loss should be medically evaluated. 5. Underlying conditions may indicate thyroid problems, diabetes, digestive disorders, or other health issues. 6. Medication interactions. Many can interact with other drugs. 7. Long-term risks. Some medications have significant long-term health risks. Medical conditions requiring weight gain. Cancer-related cachexia, HIV/AIDS-related wasting syndrome, severe malnutrition, eating disorders like anorexia nervosa, chronic diseases COPD, kidney disease, post-surgery recovery, failure to thrive in children, hyperthyroidism, celiac disease, Crohn's disease, or ulcerative colitis.